Erectile dysfunction is a broad term that encompasses a whole spectrum of issues in regards to penile function. It can include anything from inability to get an erection, to inability to maintain an erection, to problems once there is an erection. Any one of those things can come under the umbrella of what's known as erectile dysfunction. Erectile dysfunction is very common. We start seeing erectile dysfunction in teens and 20s. Usually it goes up about 10% per decade, and usually peak incidence of reporting ends up being approximately 50 and above. However, having said that, the actual incidence of erectile dysfunction is probably a lot higher than reported because of some of the stigma and shame that's associated with it. The causes of erectile dysfunction are varied. There are hormonal causes, there are blood flow issues that can cause and contribute to erectile dysfunction, there are anatomic issues that sometimes can contribute. So the actual causes of erectile dysfunction are varied. Generally speaking, they come into a couple of different broad categories. There are vasculogenic, there are neurogenic, and there are hormonal reasons for erectile dysfunction. Erectile dysfunction ends up being a clinical diagnosis. Although there are tests that can evaluate each one of the actual issues that are involved with erectile dysfunction, meaning there are tests to evaluate the degree of vasculogenic, hormonal, and neurogenic issues that can contribute to erectile dysfunction. Erectile dysfunction is mostly diagnosed by the person. In other words, if the person is having issues with erectile dysfunction, that starts to put them on the spectrum of erectile dysfunction. Although erectile dysfunction certainly increases with age, the things that can keep you healthy with age can also be helpful to help delay or even prevent erectile dysfunction. Those things are things such as diet, exercise, sleep. Diet and exercise, as you know, can help with vasculogenic function. That blood flow issue can help as far as erectile dysfunction, can help prevent issues that can lead to erectile dysfunction. Sleep ends up being very important from the hormonal standpoint with erectile dysfunction. Good sleep can lead to increased testosterone levels, and those increased testosterone levels can help with erectile dysfunction or help prevent erectile dysfunction from happening in the future. The benefits of seeing a specialist for erectile dysfunction are many. The most important thing is that a specialist can kind of tease out some of the issues that can be responsible for erectile dysfunction. Sometimes that can be treated with medication. Sometimes a specialist may be able to identify types of erectile dysfunction that doesn't need medication. Sometimes there could be psychogenic issues that could be contributing to erectile dysfunction that a specialist might be able to realize and treat without having to do any kind of intervention. On the other end of the spectrum, sometimes a specialist can be very good in terms of treating the worst kinds of erectile dysfunction and therefore having success where a person that isn't a specialist may not have quite as much success. Seeing a specialist becomes really, really important to give you a full range of treatments options that are going to work and dissuading people from some of the treatment options that really haven't been proven to work. There are many forms of treatment for erectile dysfunction. The first is to identify the reason for the erectile dysfunction. If it is a psychogenic reason, oftentimes therapy can be useful to help treat it. If it is something that is more organic in origin, there are many different types of treatment. Many people are familiar with some of the medications that can be used, oral medications such as Viagra, Levitra, Cialis. Sometimes those in combination with testosterone treatment can be useful. However, those end up being first-line types of treatment for mild to moderate cases of erectile dysfunction. For more moderate cases of erectile dysfunction, there are treatment options such as the vacuum erection device. There is also what's known as intracavernosal therapy, which are injections that can be helpful to allow for a patient to have an erection right after the injection. And then there are, for the most severe cases of erectile dysfunction, penile prosthesis, which is a surgery that can help with erectile dysfunction. There are other treatment options that have not been proven to be effective. These are things such as plasma-rich therapy for the penis or shockwave therapy for the penis. Determining which type of treatment is really important when it comes to erectile dysfunction. The kind of treatment depends on the severity and the reason for the erectile dysfunction. For some people, treatment options are going to be oral medications. For some people with more severe types of erectile dysfunction, it very well may be surgery. But the determination of which treatment is oftentimes dependent on the degree of severity of the erectile dysfunction and the concurrent medical issues. The treatment option for somebody with hypertension and diabetes are going to be very different than a young patient that may have psychogenic issues. So determining the kind of treatment really depends on the reason for the erectile dysfunction. Satisfaction rates for different types of treatment for erectile dysfunction vary. For the most commonly known type of treatments, the Viagra, Levitra, Cialis, Stendra, and the generics that are associated with this, generally speaking, the satisfaction rates are about 50 to 60%. Satisfaction rates for vacuum erection devices tend to be anywhere from 30 to 70%, depending on the study. Satisfaction rates for intracavernosal injections and intraurethral suppositories for erectile dysfunction tend to be in the 70 to 80% range. Satisfaction rates with penile prostheses, those are surgeries that are using implantable technology to give erectile function, tend to be the highest. Those satisfaction rates tend to be about 95% for the patient and 90% for the partner. Usually the long-term consequences tend to be more associated with the reason for not having erections. These tend to be vasculogenic in origin, and they're the most concerning thing when we see someone with erectile dysfunction. In fact, if we see an issue with erectile dysfunction for a period of time, we consider that as a possible harbinger of problems with the heart. So we want to make sure that patients that have issues with erectile dysfunction get a cardiology workup, at least get an EKG, possibly an echo, and see either the primary care doctor or a cardiologist to make sure that the problems with the blood flow to the penis aren't problems of blood flow to the heart or other places that can really lead to very big problems down the line in the future. However, the problems with erectile dysfunction specifically over the long term tend to be more social and psychologic in nature. We find that patients with erectile dysfunction tend to withdraw more from their relationships. That tends to lead to other issues that can compound issues with hypertension, diabetes, metabolic syndrome, obesity, weight gain. So one of the things that we want to make sure of is, of course, the erectile function itself, but really the reasons behind the erectile dysfunction that could then lead to other problems in the future.